Safety and first aid. Accident is an unplanned and unexpected event which adversely affects our body, health, and psyche. Most of the accidents can be avoided by practicing certain safety measures and rules in our daily lives. Being cautious helps us in averting mishaps. Safety at home. We should always keep our house organized by placing things at their proper place after use. Misplaced objects like toys can cause injury if we accidentally trip over them. We should exercise precaution while using electrical appliances like iron, washing machine, vacuum cleaner, hair dryer, etc. We should never be barefooted while handling plugged-in electronic devices. We must not touch electronic appliances with wet hands and feet, especially when they are in use. We should not play with naked wires. If carrying current, they may give us an electric shock. In the kitchen, we should not play around with sharp objects like knife, blade, and scissors. We should put off matchsticks before throwing them away. Plastic bags must be kept out of reach of children to prevent from accidental choking. Bathroom floor must be kept dry as the tiles become slippery when wet. We should not climb and stand on the rails of balcony or terrace as there is a risk that we may fall down. Fire emergency. In case a fire breaks out at any place, raise an alarm and rush to the nearest exit. Call the fire brigade. Keep your face covered and stay low on the ground. It is because the warm air and smoke rise up. If your clothes catch fire, drop and roll on the ground until the flames subside. No more. The emergency number to call a fire brigade is 101. The emergency helpline number to call an ambulance is 102. Safety on roads. We should always use footpath for walking on the road. We should avoid walking or driving in wrong lane of the road. For our safety, we must always use helmets while cycling or while riding on a motorbike. Wearing seat belts is a must while riding in a car. We should not use mobile phones while walking or driving on the road. It creates distraction and may result in accidents. We must cross the road at intersection only when the traffic signal is green. We should use zebra crossing, footbridge, or a subway to cross the road. To cross a road, we must look to the right, then to the left, and then to the right again to ensure that no vehicle is approaching from either side. It is not safe to run around and play on the streets. We should play in a park. We should not interact with strangers or accept anything from them. We must also immediately inform our elders about it. While riding in a school bus, we must not poke our head or hands out of the window. We must wait for the bus to halt completely before boarding or getting down from it. First aid. First aid is the primary treatment given to the victim of a sudden injury or illness before expert medical help arrives. Our house should always have a well-stocked first aid kit, kept at a place which can be easily accessed by all. Staying calm in case of a medical emergency enables us to give timely and accurate aid to the victim. Let us study some emergency medical situations and how we can be of help to the victim at such times. Amazing fact! According to a survey by WHO, timely administration of first aid can save up to 70% lives during an accident. Burn. In case of a burn, place the affected area immediately under cold running water for at least 5 to 10 minutes. It will help in reducing pain and swelling. Apply antiseptic cream or aloe vera gel to soothe the area. Apply loose, non-sticky bandage around the burned area. Change it regularly to prevent infection. Consult a doctor in case of a major burn. Cuts and wounds. Clean your hands with soap and water before tending to the wound. To prevent the blood flow, apply constant but gentle pressure on the wound using a soft cloth or gauze. Clean the injured area with water and antiseptic solution. Dress the wound with a bandage. Change it regularly to prevent infection. If the cut is deep or is caused by any rusted object, it is necessary to take a tetanus injection from a doctor. No more. To stop a nosebleed, sit straight, lean forward, and pinch your nose for a few minutes. Bee stings and insect bites. In case of a bee sting or an insect bite, remove the sting barb carefully using a forceps. Wash the affected area thoroughly with water. Use ice pack to ease the pain and swelling. Apply antiseptic cream or baking soda on the injured part. Fractures and sprains. Fracture occurs due to breakage of bones. A fracture without any visible external injury can be identified by the inflammation of the injured part. The limb could also be twisted at unnatural angle. In case of a fracture, immobilize the injured part immediately. Do not attempt to straighten the limb or push the bone back into its place. Use a splint to support and prevent movement of the broken bone. Secure it in place by tying it with a piece of cloth. A splint should not be tied too tight or too loose. It should apply just enough pressure so that the setup remains in place. Support a broken arm with the help of a sling. Apply ice pack to lessen the pain. Help the victim receive medical attention at the soonest. Sprain occurs when the ligaments attached to the bones get torn or damaged. This will cause pain in the movement of the joint. The affected part should be kept still. Apply ointment or take pain-relieving medicine on doctor's advice. Fainting. In case a person faints, loosen their clothing and ensure proper supply of air to reduce suffocation. Lay the person on a flat surface and raise his feet a little above the ground to direct the blood flow towards the head. Call for medical help immediately and stay with the victim by the time it arrives. Activity. Aim to make a first aid kit. Need a shoebox, white paper, scissors, tape, glue, important medical supplies, colored pens. Method. Take the shoebox and cover it with white paper. Use red colored pen to draw the first aid symbol on it. Put the important medicines and creams, antiseptic liquid, adhesive bandages, along with sterile bandage, cotton and medical tape. Also keep a thermometer, a small pair of scissors and tweezers in the box. Make sure that the medical supplies kept in the box are not expired date. Keep the first aid box at a place in the house from where it can be easily accessed by all.